I'm delighted to be speaking to you today about the UK Longitudinal Linkage Collaboration, or the UK LLC. The UK LLC is led by the Universities of Edinburgh and Bristol, and it's funded as part of the COVID-19 Longitudinal Health and Wellbeing National Core Study. This slide is a summary of all the work that we've been doing, and I'm going to just go through it rather quickly and go into more detail on future slides. But essentially, the UK LLC is a foreign nations infrastructure or research resource that allows researchers to access data from 20+ longitudinal population studies linked to other data sets, particularly currently NHS data sets. And we have a long-term goal to make this a sustainable research resource and make it available to researchers to do currently COVID-19 research. And if you want to see a much slicker summary than that, you can watch our animation, and the link is on the bottom of this slide. So what makes the UK LLC a globally unique cross-cutting resource? Well, we have the richness of longitudinal population studies data that includes data that's been collected during the pandemic directly from the volunteers in the studies, but also all the data that comes before. And that's what is so important for research, to be able to see the changes that happened as a result, not only of the pandemic, of the disease itself, but of the government measures that have been instituted as a result of it. This data is linked to NHS COVID-19 data sets that allow you to see who's been vaccinated when, or who's had COVID-19 tests and when they've been positive, and also wider NHS data sets, such as hospital inpatient data or prescribing data. We're also currently modeling environmental and neighborhood data about our volunteers in the various studies, and hope to link shortly to administrative records from departments like Department of Education or Department of Work and Pensions or the Tax Office. So this is a list of the 20+ longitudinal studies that are currently part of the UK LLC. There are other studies involved, but they haven't been onboarded yet. And our minimum viable product is essentially creating this novel way of linking longitudinal population studies data to NHS data. And we've worked in collaboration with NHS Digital in the first phase of this to create a novel data pipeline that allows a study to join the UK LLC and 6 weeks later be able to receive linked data for that study. We have public contributors and an access process that have been created, and 9 applications have been through a beta testing phase. So now I'm going to go into a bit more detail about what this minimum viable product looks like in reality. So we have public involvement that has 4 key touch points, and basically there's public contribution across the entire organization, and we're working in collaboration with Health Data Research UK and ADR UK as other key public involvement organizations to make sure that it's properly embedded in the UK LLC. This is what our trusted research environment looks like and how it works. You can see that there are essentially a split file mechanism so that the UK LLC team never sees any personal identifiers. The personal identifiers go to University of Swansea's secure research platform, Linkage Brokerage, which is run by Digital Health and Care Wales. They send the personal identifiers to the linkage organizations, the data providers, so the UK LLC team never sees them. And the linkage providers only provide de-identified data back to the UK LLC. The studies also provide their de-identified study data, and all of that is then fed through to our trusted research environment, which then for us is functionally anonymous. How do you access data in the UK LLC? Well, the UK LLC uses a 5-phase application framework, and it's a 3-phase application process that you start with in the HDR UK gateway to submit an expression of interest. We work with those expression of interest to make sure that they're appropriate to develop into a full application. And the key things for these applications is that currently must be COVID-19 research, and the researchers involved in the project must be based in the UK. All researchers need to be ONS approved, and research needs to be in the public benefit and there's public review. And you can see each stage of the process is slightly more onerous, with the final stage, stage 3, requiring a review for a special review for any linked data, a review by the UK LLC Data Access Public Review Panel that particularly focuses on public involvement in the research, and also that the lay summary is properly lay and understandable to the public. And finally, for each study whose data is applied for within the application is sent to their data access committees for approval against their research access standards. When a researcher gets access to the UK LLC, this is how the process works. They come into the trusted research environment and all the processing is done there. They have access to codeless and derived variables, things like definitions of long COVID or definitions of positive COVID-19 test results. They have a project analysis space, and they will have lots of code lists and code mappings available to them, and some harmonization of the basic fields across the longitudinal population studies in the UK LLC. Before anything can leave the UK LLC trusted research environment, it must go through an output disclosure check to make sure that there's no possibility of anything identifiable at all being released from the TRE. And finally, and absolutely core to our purpose, is that all research that is done within the UK LLC must be reproducible. So how do we build this new research resource? You can see that the timeline is quite tight, and essentially we received initial funding as a scoping exercise from the Wellcome Trust as an outcome of their work creating the Wellcome COVID-19 questionnaire. And this funding came to Generation Scotland and Children of the 90s, or ALSPAC. And that led to Andy Boyd, who's the director of the UK LLC, and myself to become involved in pulling together a group of vanguard studies who are interested in scoping out how we might build something like the UK LLC. And in the meantime, Patrick Valance came to the research community and said, we need more resource to facilitate quick and accurate COVID-19 research. And so we got funded as part of that National Core Studies program. You can see along this timeline that even prior to funding, we had to do a lot of work, and the participating LPS and the Vanguard did a lot of work to create the structures I just shared with you, to come up with the ideas of the split linking and all of the different bits and pieces that create the UK LLC. We only received 6 months funding in the first instance and only received confirmation of an additional 18-month funding extension in February, which made things rather challenging. So this kind of shows you the genesis of the UK LLC. But the thing to remember is it is truly a collaboration, and the work could not have been done without the involvement of all these different people within the studies. So what were the main challenges in creating the UK LLC? Well, the obvious one, and the one you just saw, is the short time frame and short-term funding structure. This meant that people were working part-time on other projects whilst working and setting up the UK LLC. We lost members of the team because there was no assurance of continuity of funding. Also, data processing is really quite complex, as you saw, and the fact that we can't view a whole participant record because of the de-identification means that if we receive linked data and we think it might not be linked to the correct person, it's very difficult for us to determine whether this is the case. Working across 24 very different LPS based in all 4 nations, all have different requirements, can be really challenging, and can be challenging in very surprising ways. You never know how a particular consent form wording might throw a spanner in the works when you're trying to set up a general process. There are lack of capacity at various points in the pipeline of creating the UK LLC, from contracts departments being overwhelmed to researchers needing to do multiple projects at the same time. And this caused us lots of issues. In fact, one good example of this is that when we started our beta testing for the access process, we didn't actually have access to the data. So we couldn't tell applicants precisely what data they could apply for. And this caused the access process in the initial phase to be quite challenging. It's also challenging to find the right balance in communication with the public about what we're doing, because these processes are very complex and there's a lot of jargon and acronyms that have to be stripped out and explained in a much more simple form, but it still needs to be accurate because the data providers want to make sure the public understands what we are doing. Finally, as all of the work that we've been doing during the COVID-19 pandemic, it's a fast-moving evolving landscape, and that poses challenges in and of itself. So what are the lessons we've learned? We've learned fundamentally good communication is absolutely essential. We work across so many different parts of the research landscape. We have to regularly talk with funders, with researchers, with data providers, with the LPS, and with our public contributors. And those public contributors are absolutely crucial to make sure that we can effectively communicate what we are doing. We can make assumptions, as I said in the last slide. Many LPS are set up in similar ways, but there are always crucial differences. And one of the things that is absolutely fundamental to the UK LLC is that the core relationship is between the study and their volunteer. And the UK LLC doesn't come between that. The studies make the decisions. They are the ones who know what they are committed to in relationship to their volunteers. In a fast-paced environment with lots of changes and trying to get things done quickly, good documentation is absolutely essential to make sure that new members of staff know what's been done in the past and how we do things in the future. And when you're creating new systems, it's important to test them and not lock them in and make sure that it's an iterative process that can be changed. As I said, you don't make assumptions about LPS, and that could mean that we have to change our systems. We also received invaluable advice from other groups that have done different parts of what we're doing previously. So many thanks to the people at Dementia's Platform UK, the BHF Data Science Center, and the SAIL team for providing us with advice and help in figuring out how to set up our processes. Finally, we started as a scoping exercise, but from the beginning, we thought about the future. We thought about this as being set up in the context of a pandemic, but this resource is potentially hugely invaluable, and we want to try and future-proof it so that it can work beyond the end of the pandemic. So what are our future plans? Well, we need to consolidate our minimum viable product, of course, but also make sure that the user experience is good, that users who aren't familiar with LPS data and users outside the national core studies can work with our linked data and work with our LPS data and create reproducible research. We're hoping to enhance our resource with administrative records in the near future and ultimately provide an efficient and predictable data access for analysts. And in the long run, we hope to expand out beyond COVID-19 research. Thank you very much.